Hello, everybody, and welcome back to the Dental Practice Survival Guide. We are so excited to be doing this again today. Those of you who were with us yesterday know that there was just nonstop fantastic information and viewed by close to 1,000 people all over North America. So welcome back, everyone. I'm Dr. Richard Madow, co-founder of the Madow Center for Dental Practice Success, and I'm here, as always, with my fellow co-founder.
Hey everybody, Dr. David Madow, great to have you. Rich, yesterday, actually, I think the number now is, with the replays, well over 1,000. We want to thank you so much for being with us yesterday. Today is going to be fantastic. And I was going to say something else. Rich, let me pass it back to you for a second. I'll come back on in a couple of minutes.
You need a couple seconds to remember what you were going to say? You know, it happens at a certain age.
Don't even go there, please. Please do not do that.
Couple quick announcements for everybody. We had a bunch of people ask about continuing education, whether our webinars qualify for CE credit, and we didn't really announce it, but of course it does. At the Madow Center, everything we do qualifies for CE. So you'll be getting an email from us on Monday with your instructions on how to take care of your CE. And it's really great that during this really crazy time where nobody knows which end is up, that you're taking the time to learn, to attend webinars. We know that you could be goofing off or reading books or binge watching things on Netflix, but and you're probably doing all those anyway. Hopefully some exercising too, but you chose to spend your time with us. And not only do we appreciate it, but we congratulate you for doing things that will benefit your practice during this crazy, crazy downtime.
I'm looking at the number of attendees and it's ticking up really quickly. We're over 250 right now and it's going very fast. So what I want to do real quickly is what we did yesterday, but I want to make sure, because Rich brought up a good point yesterday. When you send a chat, by the way, there's two possibilities. You could do a chat or a Q&A. It's better to put your chat in the chat box. So go click where it says chat, but not only that, where it says to, make sure you click on the drop-down box and the drop-down arrow, and it says, make sure it says all panelists and attendees. So that'll be your default if you do that. And then whenever you say something, it will go to everybody. Now, if you want to send a private message, say, for example, to Betty, you can certainly click send to Betty. But in general, when you send a chat so everybody can see it, especially if it's a really good question, make sure it says all panelists and attendees. And actually, now would be a great time, like we did yesterday, to tell us where you're from. Let's see who's here. Let's see where you're all from, and welcome.
I'm going to do it too. I'm going to say where I'm from.
Woodmere, we know who it is from Woodmere, New York. It's Beth Berman.
Hey, Beth.
Ohio, Glenview, Illinois, Boston
Springs. Wow.
We got Fargo again.
Edmonton, Alberta. Beautiful.
Wow. Welcome. The OC. Yes, we love the OC.
Wow. Haskell,
New Jersey.
Cleveland, Ohio. Someone from beautiful downtown Pikesville, Maryland. I think I know that guy. Wow.
I love Detroit in capital letters.
It's the D. The D always needs to be capitalized.
Rich, did you say beautiful downtown Pikesville, Maryland? Is that what you said, or did you say
no, I didn't say Pikesville because I'm no longer from there.
Oh, okay, I got you.
Actually a very, very special guest say that he's from beautiful downtown Pikesville, Maryland. So maybe we'll even get to that in a minute. Yeah, fantastic. Before we bring on Dr. Reef, and we talked quite a bit about her yesterday, she's an extremely successful practitioner in the suburbs of Baltimore, Maryland. So Dave and I have both known her personally for quite a long time. She is just a real energetic, go-getting, think outside the box kind of marketer. And during the COVID-19 crisis, we need a better name for this than the COVID-19 crisis. Maybe something a little catchier. But she's really stepped up to the plate and thought of ways that she could continue growing her practice and continue doing good things for her patients during this crazy time. So again, we're going to bring her on in just a couple minutes. If you have questions, please, as Dave said, throw them in the chat box, and who knows what's going to happen at the end. Should be fun.
I like that. Who knows what's going to happen at the end? Because we definitely will take Q&A, but who knows how long this thing is going to go. We'll keep it to a reasonable amount of time, I think.
So before we bring on Dr. Reef again, I just want to say many of the questions we've had have been concerning financial matters, the PPP, the CARES. I know we're all hearing so many different things. And I love it when somebody like throws up a question on Facebook and they say, hey, who knows about what can we do to get a grant to cover our payroll? And everybody's giving all kinds of information, or more likely misinformation. And that's nothing against Facebook. We love our Facebook group, The Dental Place, but it's not always the best place to get accurate advice. So since we've had so many requests, we are talking to somebody who is probably the best expert in the country on all items that are dental financially related. And we're hoping that next Thursday at 1 p.m. Eastern time, if everything falls into place, we'll be doing a webinar on those topics. What are the government programs all about? What should I be doing now to make sure that I get the most benefit from these programs? What are the limitations? What are the rules? Nobody seems to know the answers. So we are putting that together, and tentatively, and you'll be hearing more about it, next Thursday at 1 p.m. We're talking right now to somebody who we feel is the #1 authority in that field, and when everything comes together, we'll let you know all the details.
Rich, before we introduce Dr. Reef, we got some questions regarding this yesterday, and I just saw one come up from, it looks like from Nick. Nick's question was, Barbara, are you available for coaching? And Nick, thanks for asking. And anybody that asked a similar question yesterday, we really appreciate that. What Rich and I did not want to do during this crisis, we did not want to come on and do a webinar and for the sole purpose of, you got to use us for coaching. I mean, of course we're available for coaching, but in this really difficult time we're going through, that's like probably the last thing on people's minds. I mean, it is very important, but right now we're trying to do a webinar to help our dentistry community at large, and not really push any products or push coaching. However, since you did ask the question, and anybody else listening, and they may have asked this question yesterday, of course we are available for coaching. As I said yesterday, we work with the best coaches in North America. There is no question in my mind and no question in Richard's mind. We threw out some email addresses yesterday. I'm going to throw out another one today, not yesterday. So if you have a pen or a pencil in hand with a piece of paper, write this down, because I think this will be the most direct way to get to us and get a complimentary call just to see if coaching would be right for you, and talk about what your needs are. Sylvia, I'm going to do this. If it's okay, it's going to go directly to Sylvia, and the email address is Sylvia, Sylvia, Sylvia@Madow.com. Sylvia, I think you could probably see her on your screen right now. She might be frozen, but she's the one kind of behind the scenes producing this entire thing. She runs the show at the Madow Center, and so this will go directly to Sylvia, and she will be able to facilitate a call, a complimentary call with one of our coaches, and we can see what we can do for you. But so thanks for asking the question again. We're not here to push anything on you. We're here to really help you through a really difficult time. But if you're interested, simply email Sylvia@Madow.com.
And if you're wondering who the heck is Sylvia, yesterday, if you were with us, you met 3 of our incredible coaches, Betty, Kara, and Barbara. You met our fantastic marketing specialist, Whitney. You probably know me and Dave already, but you didn't meet Sylvia maybe because she is doing everything behind the scenes. She administers our coaching program, our distance learning programs. She is our tech whiz who puts these webinars together and does all those great things. She does so many things. We suspect she has 28 hours in a day, although we're not sure. So how about a round of applause for our fantastic Sylvia? Yeah.
I think it's pretty safe to say that this webinar would probably not even be going as smoothly, or going at all, without Sylvia at the helm controlling this whole thing at her control panel in her home office there. So again, yeah, she's helping us with everything. So she's the absolute best one to probably email to get this thing, get anything going. Any questions you have, just send it right to Sylvia@Madow.com.
Fantastic. Well, we already told you a lot about our special guest speaker today. For those of you maybe who had trouble getting on and just joined us, I'll do it real briefly again. Dr. Joanne Reith is a dentist in Owens Mills, Maryland, which is a suburb of Baltimore, very close to where Dave and I both grew up, actually. I can't remember if she's a 2nd or 3rd generation dentist. You can hold up your fingers, Joanne. 2nd or 3rd? She's a 3rd generation dentist. That's right.
But I think Owens Mills, Maryland must have like a lot of 3rd generation dentists, if you know what I mean.
I can think of at least 2. Probably more, but I think at least 2. Anyway, she has a fantastic practice that she grew under some difficult circumstances when she bought this practice. And it's caused her to always be an out-of-the-box thinker when it comes to not just her fantastic clinical skills, but also the way that she grows and markets her practice. And as we said yesterday, she was preparing for a really big lecture at the Connecticut State Dental Association, a place that Dave and I lectured several times and really, really love. But of course, due to this whole chazarai going on, that had to be postponed. But she has so many great ideas and no one to tell them to right now. So we thought, why the heck don't we invite her on our webinar today and have her do it. So without any further ado, I'm going to hand it over to Dave to do the big intro. You look like you're just raring to do it.
Oh, wait a minute. I thought you did the big intro.
I didn't do it yet. We're
you didn't do
ready.
it. You didn't do it yet. Okay. So but you said a lot.
I know you could just say her name.
From yesterday and today, we said a lot about Dr. Reef. She's a dentist who, she's probably one of the best marketing dentists we've ever met. And not only is she a great marketing dentist, but I've had the privilege of actually being one of her patients when I was in the Owings Mills area. She runs a great practice. She walks the walk. She's not one of these people that is up on the podium or up on the ivory tower telling people what to do. She's doing everything she talks about all day, every day. And a little known fact about this before I bring you on, Dr. Reef, is that Joanne used to be a hygienist in her previous life. And I don't know how much you want to go into that, but it's a really cool story. Maybe one day she'll tell that story. She's done it on our audio series before. She was a hygienist, then she went back and went to dental school, and now she's doing dentistry full time. But she did clean my teeth in a pinch. Was that about 3 months ago or something like that?
Yeah.
And she did a damn good job. I really want her next time as well. So without further ado, let's all give it up. Let's be a big round of applause for Dr. Joanne Reef.
Thank you. Can you hear me?
Yes.
Can everyone hear me? Okay, great. Okay, I didn't know if I was muted. Okay, great. Well, welcome everyone. I'm really excited to be here. And I just want to kind of tell a little story of how this whole idea of this list of things that you can be doing at home came to be. About 3 weeks ago, I was on a dental forum. And this was before offices were even mandated to close. There were some like young associates on there on the forum, and they were really worried about how they were going to be able to remain employed in their offices if they were shut down. Now, keep in mind, this was before the CARES Act. So I quickly typed a list of about 12 ideas that associates could present to their owner docs. And most of these could be done from home to continue to be productive. Many of these ideas, I had a feeling that the owner doctors couldn't do or wouldn't want to do. So now this list has exponentially grown, and I've gotten more than 2,500 views of this list, which I shared to a lot of different groups and social media. And today I'm going to go over a bunch of these ideas, many as we can in the hour, whatever we have. And many of these I am doing from home now, or I've already done with my team before we shut our doors, but some of those things can still be done from home. So that's kind of the background of how this all kind of started. So I have it sort of like in some categories that Dave had given me. And the first thing is going to be downtime projects that will pay off in big rewards for years to come. So first and foremost, create a group text or group email for your whole team. And please stay in touch with your team at least like once or twice a week. Your team is your biggest asset, and we all need our teams. Next, many of you have already done this, but I'm going to mention it anyway. Make sure you have some kind of a pop-up or banner on your website and your social channels that states that you are open for emergencies and how patients can reach you. If you have the capability to book online, like I do, have a button for them to click. I use LocalMed for patients to be able to schedule online. In fact, right before this webinar today, I had a new patient scheduled through LocalMed on my schedule for this Monday that's having some type of an emergency. So of course, after this is over, I will touch base with that patient and find out all the details. So LocalMed, if you're not familiar, is owned by Dental Intel, which is a dental software company that tracks everything that you do in your practice. LocalMed now is, if you go on their website, you can probably find out they have a bunch of webinars, the same one, I believe, several times a day. And if you're a LocalMed user like I am, they will give you Dental Intel for free now and vice versa. And they've created some ways through Dental Intel to be able to utilize some of their information for when you get ready to get back up and open your practice. So I really was sort of like, LocalMed, this will never work in my practice. We have 3 hygienists, 2 providers. How will they know? It'll get mixed up. It won't work. Well, they gave me a free demo, and it was a 30-day demo, and I was sold. And I love Local Med, so that's just one tip. So while you're at home, if you're not using Local Med, you could actually reach out and find out more about it. If you do use them, make sure you have that button on your website so patients still can schedule their emergency appointments, or some of them may even schedule appointments down the line for cleaning when you reopen. So that's just one really great tip, to make sure you have the banner and that you're looking to Local Med if you're not using it. Now, I was speaking about websites. So look at your website and add some new content, or give it to your marketing company or your web designer and let them add the new content. For example, I had been on someone's website recently and I saw a drop-down tab for spa amenities that the office offers. Well, I offer a lot of spa amenities at my office. So I created this list last week of all the spa amenities that we use. Let's say warm neck rolls, the lemon scented hand towels, the noise canceling headphones, just things like that that we're doing in my practice. And I made this list and I sent it over to my marketing company. So these are things that you can do from home, kind of like look with a fine-tooth comb at your website and see if there are things that you can add to your website. If you want to get some ideas, you can check out my website at crossroadsdentalarts.com. Another thing I did with my website is I wrote some bios. I have a couple of fairly new employees and we had not written their bios yet. So before we closed, I had them give me their bios. But even more importantly than the bios on your website, get your team to write their why. And what I mean by this is, in other words, why did they pick a career in dentistry? So if you look at my website, where most people would have the employee's name, it has their why. And below it, their bio is just some bullet points, because I think that the why is actually more important. So again, you can look at my website at crossroadsdentalarts.com and you can see the team's whys and their bios. So again, this is something, if you don't have this, you can have your teams be doing this at home. Another thing that I'm doing is I want to learn a new skill. So I would recommend that everyone learn a new skill. Now this could be clinical, it could be business or marketing related. For me, I really been wanting to take a dental branding course, but I knew I didn't have the time. I was working full time and I was getting ready to give this course in Connecticut. It was really consuming like pretty much all my free time. But now I signed up for this dental branding course. It meets via Zoom every Monday. We have modules to watch during the week and I have homework. So just check it out. There's lots of free courses, CE courses out there that you can take advantage of. Check your emails, check social media. Many of these offer CE credits. And this is also great for your team. I have one of my hygienists taking the Perio Protect course online. Something we don't offer in my office. I also love podcasts. So go into iTunes for any dental podcasts, including the Madow podcast. But you can also look for motivational podcasts or any business podcasts. So let's go back to, I was talking about my branding course. So while you're home, work on your brand strategy. Figure out your purpose, your vision, your mission, and your values as a practice. Write these down and then begin to tell your story. Work on your story. Your story is really compelling. These are the things you really just never have time to think about. Then I want you to think about who your practice avatar is. This is your ideal patient. I want you to write down who that ideal patient is. Are they a male, female, single, married, kids, where they like to shop, where they like to eat, and then give them actually a name. This is who you're going to market your practice to. All right, the next section is going to be on virtual consults, teledentistry, and I'm going to talk about the CDC codes that we should be using. So virtual consults or teledentistry is a very new concept for a lot of us. I mean, it's been around in medicine, much longer. When you're doing these consults, you need to be using a software that's HIPAA compliant. Right now, the HIPAA laws are a little bit more lenient, but you don't want to take any chances. In my office, we're using the Weave phone system. So I had the capability to have patients text me photos or videos, let's say of a broken tooth and a swelling in their mouth, But you can also use things like Smile Snap. There's Doxy.me, the mouthwash intraoral camera. A lot of us have the mouthwash. You can use that for the teledentistry, and also Opera DDS. This is just some of the ones that are out there. To understand more about virtual consults, I would go to the ADA website and search for ADA COVID-19 coding and billing interim guidance. I would highly recommend that you do not use Snapchat, WhatsApp, or TikTok for these teledentistry meetings that you're having with your patients. As far as coding, the code is D9995. Write that down. It's a teledentistry code, which is in real-time video or audio. And this is what you're going to submit to the dental insurance company, but most likely it will not be paid. I have heard that Dominion Dental is paying for this code. Do not use the D9996. That's not considered real time. You can charge anywhere between $15 and $50. Well, you can charge whatever you want, but that's what most people are doing, between $15 and $50 for that code. But also charge for the limit exam, the D0140, which that will be paid for. Remember, when you use that D0140, it's only going to be covered twice a year. But if this is a follow-up treatment of something that happened, let's say you saw the patient in your office before the close of your office, you can use the D0170 code, which is a follow-up code. Again, I'm sorry, that's the D0170. Again, that probably will have the same twice a year limitations. Also, make sure that you document in the patient's chart your method of communication, the chief complaint, differential diagnosis, recommended treatment, and your referral if you are referring the patient. Remember that teledentistry may be limited or prohibited by state law or the State Practice Act. The next thing I'm going to recommend is you starting to use a 12-month blog. So have you, as a doctor or team member, begin brainstorming ideas for a 12 months worth of blogs. And these are going to be on your website. Come up with 12 ideas, one per month. Begin writing these blogs, but turn them over to your marketing company and have them edited by a professional who knows what Google's looking for. Because a lot of times Google wants backlinks and this and that. And if you just write something, you know, you're not going to have all that Google's looking for. So if you're like really stuck and you have no idea what you want these 12 ideas to be, all you have to do is go into Google and put in the top, whatever, 20 dental blogs, and you'll get lots and lots of ideas. Please make sure you're not plagiarizing. All right, now we're going to talk a little bit about social media. So what I recommend is while you're at home, and I'm going to do this probably starting next week, learn a new platform. Find a new platform that you're not using, and find one that will resonate with the kind of people that you're marketing to, your practice avatar. Let's say you're already on Instagram and Facebook, so maybe learn Pinterest or TikTok. If you're not using Canva to design your posts and stories, start a tutorial. Canva is a way to, you can make anything from an invitation to a flyer to a post that you can use on Instagram or Facebook. And then learn how to take your logo, your branded logo, and add that to your post. And you can do all of this through Canva. If you're on Instagram and using Instagram, go to your bio. Let's take a look at your bios and let's redo them. You want to make sure your bios, you can only have 150 characters, including spaces and emojis. If you want, go to my bio. I just redid mine, and my handle is @Crossroads Dental Arts. Look at your bio. You can look at my bio and look down where it says Linktree. Linktree is a shortcut for patients to go on to your website, and it's also a free site, by the way. On mine, besides going, and again, it's a shortcut. So when you look at Linktree, it'll say about the doctor, and it's also going to say local med. So I've put local med, the widget, into my Linktree. So people can click on that local med and again, ask for an appointment. Well, they're not asking, actually they're booking an appointment into your practice management software. The next thing I recommend is start creating sets of hashtags. I put these in the notes in my phone. And you do this so you can copy and paste them as needed. So for example, I'll make a set of hashtags for dental hygiene, for cosmetic dentistry, all in for dentures, and all these are in my notes on my phone. So all you have to do is copy and paste these into your Instagram posts, and then you'll have all your hashtags in there. Sometimes I'll add an extra one if there's something with that post that I want to add a hashtag to. Next thing you could do is you could learn to use Planoly or UMUN. And these are to help you with your grid, your Instagram grid, to be able to decide what you want to post, when, and where. So in other words, if you look at your Instagram, if you're using Instagram, you go down, or you can look at mine, you'll see all my posts, okay? So you want to make sure that you don't have, let's say, 2 testimonials 2 days in a row, or that you don't want 2 quotes 2 days in a row, or before and after pictures. You want to have like every 5 days. So that if you use something like Planoly or UMUN, you can plan all this out, and you can do it like a month at a time. It's sort of like set it and forget it. But if something comes up in the meanwhile, you can always change it and add a post. The next section we're going to talk about is ground marketing strategies, and have them ready to go for when you get back to your office. So ground marketing, for those of you who are not familiar, is also called guerrilla marketing. And this is a way to spend very little money to bring patients into your practice. I've been very successful with some very simple ground marketing ideas that I want to share. My first idea, and I bought this on Amazon, and again, you can do this from home while you're, having some downtime. It's a plastic holder for brochures that has a place to put my business card. You can order these from Displays to Go, and I'm sure there are other places to order them also. It's called a 4x9 literature includes business card holder. It's $2.65. So I print off flyers at my office. You can also have, a company do this for you. And what it says is free whitening for all new patients. And I put a picture of a smile. On the right side is before whitening, and the left side is after. And I place these flyers in the plastic holder with the business cards. And I put these into any businesses that will take them. My ROI, my best ROI, believe it or not, has been from Smoothie King across the street from my office. I know this sounds crazy. It's true. I've gotten some fantastic patients, and some of them didn't even ask for the free whitening or need free whitening because they needed veneers or wanted veneers. It's been a great ROI for me. And what I do for the whitening is I give them the 10-day opalescence strips. I don't do, the custom trays or anything that's more expensive than that. I just give them the free opalescent whitening strips. You can take these same holders with these flyers, and you can put them in bridal salons, beauty salons, nail salons, local gyms, anywhere that will take them. Another ground marketing idea that I want you to start doing at home is to make a list of all the specials that you refer to in your area. And when you get back to work, I want you to send them all a fruit platter with a fruit and yogurt platter with some mini muffins, something that's semi-healthy. I wouldn't send, big tins of chocolates and things like that. But especially, I want you to send these to the oral surgeons, endodontists, and GPs that may have treated some of your emergency patients during this closure. I love marketing to specialists because a lot of the specialists, have sent me patients over the years. I want to show my appreciation. You don't want to make this a one-way street. We get lots of patients referred by specialists, especially pediatric dentists, since all the kids that see the pediatric dentist all have patients, and those have parents, and those parents all need a dentist. Make it a priority to market to the specialists in your area. Then another thing I would do is to figure out which insurances that you participate with that may have the best fee schedules. Find some patients in your practice that work at some small businesses. And I want you to also send the fruit and yogurt mini muffin platters to those also when you get back. Your office manager or financial coordinator should be familiar with a lot of these insurances. Then also make a list of some of the patients who work in small businesses where you're out of network with, and do the same thing. Send them some of those platters of fruit and yogurt. It'll go a long way, and you'll definitely get other patients from those businesses. Make sure you include your business card and like a nice little note with it. And maybe have your office manager or somebody take that over, because I'm sure, you will not have time when you get back. Hopefully we won't have time. The next thing we're going to talk about is whether you should respond to Google reviews now. Okay, so let's back up a little bit. And I want to talk about something that will tie into the Google reviews. I highly recommend take some time and make sure that you've claimed your Google My Business page. If you don't know what I'm talking about, go into Google and type Google My Business. Set up your account and make sure that your NAP, that's your name, address, and phone number, are consistent on all your citations. By this I mean when you Google your name or practice name, everything is consistent. So this is another good project, clean up your citations. All you have to do is Google your practice name and you'll find everything from Yelp to health grades is going to pop up. Make sure all the citations have the same information. For example, my office has a suite number. So is it SUITE or is it STE? Make sure everything's the same. Once you have all your information in Google My Business, then you can add photos of your office, your team, and then you can also post on Google My Business. You can take the same content that you're using on Facebook or Instagram, and it's just like that. You go ahead and post. Now, on your Google My Business page, your Google reviews are going to pop up. They'll show the most recent ones first. So take the time to respond to these reviews. I'm sure other times of the year you don't have time. Now you have some time. Now, if you have 2,000 reviews, you don't have to go back and respond to 2,000. Go back to the last, I don't know, 30, 40, whatever you have time to do. I heard a podcast recently, and the dentist asked a new patient, how did you find out about the practice? And the new patient's response was, they liked the fact that the dentist took the time to respond to reviews. So when I heard that on a podcast, I started doing that. And it's easy to do if you just go into Google My Business. All right. How do we become the best known dentist in the community while sitting on the sofa? That was written by Rich, by the way. Okay. To begin with, call your dental software company if you do not know how to do this, and find out how to get a list of all the patients in your practice that are over the age of 80. You could do 75, you can do 85, I chose 80. Call all these patients and find out how they are doing and do they need anything. One of my patients posted this on Facebook that I called her and how impressed she was. Then I shared this to all my followers. People are going to remember this for a long time after the virus. Next, I would get together all your excess PPE and even order extra from your vendors. Put your PPE on auto renew. And when you receive this, please donate this to the local hospitals and other organizations that desperately need this PPE. No matter how much or how little excess you have, the hospitals need it. Take a picture of you giving it to whomever you drop it off to and post this on social media. You can even watch a tutorial that's going around and learn how to make the face shields at home that you can donate. Next, I'm going to recommend joining a Facebook group in your community or community that's close to your practice. For me, I practice in Owings Mills, but the group in Owings Mills is not that active. But the town next to me, Reisterstown, has a very active group of over 8,000 members. So I joined both groups. So what you do is you go into Facebook, at the top, you'll see a little glass, the little glass there, to click into that and just put the name of your community. I joined both groups, and once you're accepted into the groups, you're going to start receiving notifications when people ask questions in these groups. You will begin to notice that people will sometimes be asking for recommendations for a dentist in their area. So when you see this, you may or may not be listed as a dentist that's recommended. But regardless, go and send a private message to these people who are looking for dentists. Introduce yourself, start a conversation with them, and have them come in for a free consult and send them to your website. You can also ask a question in this group or give dental advice. As people start to answer or respond, again, go send them a private message and start a conversation with them. Make sure, though, these groups all have rules, and usually there's like one day of the week where you can actually advertise your practice, but make sure that you're following the rules because you don't want to get booted out or kicked out of those groups. All right, How are we going to jumpstart our future schedule? Here we go. First of all, please do not cancel any of your patients. A week or so before their appointments, have the doctor or a team member, if they're still on payroll, I'm doing this myself, to reschedule, not cancel any appointments. You want to reschedule them when you think you are going to open. What I've decided to do is use the beginning of June as my open date. Now, when I'm calling these patients, I know it's hard to believe, I've had 100% of the patients that I have called have rescheduled for June or thereafter. Nobody has said to me, I'm waiting till all this is over. I'm actually shocked. And I think it has to do with the fact that I have called these patients. Now, this is not an easy task. I'm spending probably an hour and a half a day doing this, but I think it's really important. Now, when you reschedule these patients, we use Dentrix, but I'm sure there's something similar in other practice management softwares. I'm placing them on an ASAP list or something equivalent to that. And that way, I'm telling the patients, I'm putting you on an ASAP list. And if we are able to open sooner, we're going to call those patients. And, again, if we have to bump them out further, unfortunately, I'm going to have to call them again. So this way, if you open, let's say, the middle of May, you're going to go right to your ASAP list and you're going to call those people because you know that those are the ones that you had already put off a bit. Now, it's nearly impossible to get people to commit to an appointment after the fact. And this is why you don't want to put them on an unscheduled list or just cancel them. You never want to cancel them. If you're putting people on an unscheduled list, I think it's much harder to get somebody off of an unscheduled list than to get them, to reschedule and just have them come in sooner off that ASAP list. Now, before you hang up with the patient, please tell them to be safe, be healthy, and let them know that you appreciate them. This concern will go a long way and patients will remember that you were concerned. If you have to refer a new patient that calls on the phone to a specialist because let's say they need an extraction or root canal and you don't have the team to do it or you don't perform those procedures, I would try to meet them at the specialist's office. Now, I know this is difficult, but a few weeks ago when this started happening, I had 2 patients call me and you could tell they both needed extractions. I didn't have the team there to help me. So what I did was, one was a new patient, one was a patient of record. I was able to schedule them back to back with the oral surgeon who happens to be right next door to my office. And I actually met the patients there and I gave the new patient a new patient toothbrush bag with my business card in it. And I followed up with both patients after the procedures. This is great marketing. And I know not everyone can do this, but it will go a long way if you're able to do even some of this. Another idea I wanted to talk about is something that I did before we closed, but again, this can be done even now. If you're able to do this, have the front desk team members go to the office or if they can log in from home, they can go to my PC, hopefully, to access your practice management software. I mean, there's other ways. At my house, I use Go to My PC. Print off a list of all your patients who are overdue for recalls for the past year. I did this and I paper clipped them by month and brought them home. Then I called the company who does all my printing and asked them to make me a set of postcards that were bright green. And you do this so they'll stand out in the mail. Now, this is an idea I learned from Sandy Pardue years ago, that you want to use something that's really going to stand out. So I used a kind of an ugly green background with my branded colors on top of that. And, I had a sample at home of what I wanted the postcard to say, that they were overdue. And when it gets closer to opening, I'm going to send these out. If you have the manpower, at your practice now, or even when it gets closer, you can have them call all these patients. But for now, I'm going to send these postcards when I know we're about to open. Now, this is in addition to my Weave system, who is going to be sending out the emails for people who are overdue. As many touch points as you can, it's never too many. If you're using Lightforce, Lighthouse 360, Demand Force, all those things, I would not stop, you're paying those vendors. For that, I would definitely keep that going. You're going to need your hygiene schedule filled when you get back to help build up your restorative schedule. Remember that approximately 30% of the treatment that comes from the doctor for the dentist to perform comes out of the hygiene rooms. So 30% of the restorative that you're doing is coming out of the hygiene rooms. Just remember that. So you want to make sure that your hygiene is, very well scheduled. The last thing that I wanted to recommend is have your team members, if you can, go through your practice management software and purge all patients who have not been to the practice in a while. This is a huge job. You never have time to do this, and I'll tell you why we're going to do this. I chose 2017. So if patients have not been to my practice since 2017 or longer, I inactivated them and took out their insurance information. This is important if you're, in the future going to sell your practice or you want to bring in a partner. You want to know exactly how many active patients you have. It's also important because if you decide you want to maybe go out and network with an insurance, at some point you'll have a better idea of how many patients, for example, have Blue Cross Blue Shield. You don't want to think that you have 700 patients when 200 of them are inactive. Now what I'd like to do is touch on a few things that we talked about yesterday. And the first thing has to do with vendors that you're reaching out to. I called iTero, that's my digital scanner, and because I just got a monthly charge of $360, and I'm realizing, wait a minute, I'm not using the iTero scanner, and I called them, and they're going to waive the next 2 months for me. They asked me when I thought I was going to open. I told them June. If God forbid it's longer than that, then I guess, I will call them back. So please look at your P&Ls, look at your credit card bills for some vendors that you may not have thought of. Do not cancel any vendors that you're using now for electronic claims or attachments because you may be seeing emergencies, or if you have someone in your office posting your insurance checks, you may need these services to be able to send to secondary insurance. If you have any warranties on your sensors, ask for a deferment also for that for several months. And the next thing I wanted to talk about has to do with discounts for treatment when we reopen. I would recommend, if you want to, this is if you want to offer discounts for things like cosmetic procedures, whitening, veneers, as a promotion when you open, since these are not covered services by insurance anyway. Or if you want, you can also discount like signing up for your membership plan if you choose. We talked about the membership plans yesterday. I know the Madows have a great package for all that. I hope that I have given you a sample of some of the ways that you can use your time at home to really jumpstart your practice. This, believe it or not, is only a small sampling of the ideas in the list that I have created. And every day, like I said, I'm adding to my list. So I wanted to mention that besides working on my lists and all the things that I'm doing at home, I have reached out to about 6 young dentists who recently bought practices or have startups. I highly recommend that you do this. And I have also had many dentists my age and older reach out to me for sharing knowledge. It's critical that we help our colleagues out during this unprecedented time. I literally have been working nonstop every day to gain knowledge about the stimulus package to help ensure that my practice is ready to rock when we get back. It's all about working on your practice, not just in your practice. So please reach out to me at dr.jbr@crossroadsdentalarts.com. If you want any help or any questions, I'm certainly available by email. And I can also send you the whole list of ideas that I've created if you reach out to me. Thank you, Rich and Dave, for giving me this opportunity today. I really enjoyed being part of these 2 webinars with such great people, including all the consultants from the Madow Group.
Oh, had to unmute there.
I was muted too. Yeah, congratulations. That was beautiful, Joanne. That was really
Thank you.
Really good. I think everybody really enjoyed that. And I was looking at the numbers of participants on the webinar here, and nobody dropped off. Everybody was like catching every word you were saying. So
Great.
Thanks so much for that.
It's funny. It's kind of a cliche when you say it was nonstop information, but that was absolutely nonstop information. Joanne, I don't know if you have access to the chat box, but a lot of people are asking for your email address, so you might want to type that in there. Wow.
Really, type it in. Okay, I'll type it in the chat. That's really, a great idea.
Really great stuff. So since everybody's here, we still have a few more minutes. I know there were a bunch of questions that came up. I know, Kara, you had prepared some of your frequently asked questions that people seem to be asking you like crazy. You ready?
Yes.
Now a good time for you, Kara?
Yeah, let me pull them.
Great. For those of you who weren't with us yesterday and are with us today, you certainly have met Dr. Joanne Reif, but we also have 4 of our incredible team members were in our webinar yesterday, and they're all here today for Q&A. Kara Jones, one of our coaches, Betty Hayden, another coach, Barbara Thurs, another coach there, incredible, and Whitney Beauregard, who is our marketing specialist, who does other things with practices as well. She's here. You know me and Dave, and Sylvia's behind the scenes, so we won't introduce her again. Just to make sure everybody's up to speed.
All right. So some of the questions that we saw yesterday, one talked about what will change in our waiting rooms. You know, we don't know what's going to change as far as once we reopen, but the things that you should be doing now prior to the patient coming into your office for any emergency care is when that emergency phone call comes in, is identifying obviously what that emergency is, but then asking the patient if they've traveled internationally or domestically in the last 14 days, and do they have or had any symptoms or infection that could lead to, you know, contamination of you or your team. When they do arrive, you should create a virtual waiting room. There's no reason for you to have multiple patients coming at the same time during this time, and try to create some separation in between the appointments if you decide to do emergencies on a certain day. And ask them to give your office a call, or if you're using text communication, to let them know that they have arrived when they're in the parking lot. And then at that time, you can invite them into the practice if you don't have anybody else in. So it just kind of protects everybody, including the existing patients that's there. As we all know, what's being stated is you may have this virus and have no symptoms. And so even though they may answer these questions as, no, I'm good, I'm healthy, you know, you just never know. So this just kind of creates some separation and that distancing that they're really pushing for currently. When they do come into the office, you want to, again, ask some of these same questions. Some emergency patients aren't being seen the same day. And so remember that things can change from day to day. And so those same questions should be asked when they arrive and they do their virtual check-in. You need to be taking temperatures on your patients when you're seeing them, preferably either the one that brushes across the forehead or possibly the ear. And if anybody has a 99.1 or higher, you should refer them to their medical doctor and not treat, not even invite anything else after that. You may have to, if they're in the pain that they're coming in for infection and such, you can make that decision on what you give them, if it's a prescription or not, but don't treat in the office. Make sure that your team is following the recommended PPE based on your current state guidelines if you need to treat a patient under essential procedures being performed. Some states are requiring face shields or the N95 mask. You need to know what your state is recommending so that you can stay in line with that. If your practice can't support those needs, you may have to refer the patient. And one of the things that Dr. Reif stated is get to know what dentists in your area are treating patients, because they might have the right things to see, especially if it's a specialist. Maybe they have these face shields and things to see your patient if you can't. So maybe get together with some of your local offices that you refer to and see how they're handling emergency patients currently. If you are doing something and you have to maybe do an open and drain to get patient out of pain, if you're doing some kind of procedure, they are recommending using rubber dam. So if you don't use rubber dam, that's another way that you can help an extra layer of protecting yourself and your assistant. Making sure that your high-speed handpieces, when you're using them, that you are putting them through the right sterilization, that you're not just wiping them down. You should be putting them through, you know, your autoclaves and make sure that you're doing the proper disinfecting, okay? Another thing that kind of came up would be, should we still bill patient balances? Absolutely. Just because you're not open doesn't mean that you still shouldn't be working your existing AR and try to get as much in the office as possible. We mentioned yesterday that A great way to offer some relief to some of your patients if you're in a spot that you can is by offering, maybe a discount if they pay in full, kind of as a one-time courtesy, but just review and don't kind of get caught up in too much of discounts, especially if you're a preferred provider with insurance. So make sure that you know what those, what your documents state as being a contracted provider. Make sure that you also offer and give them the opportunity to call your office, maybe to set up payment arrangements, but you still should let them know that yes, there's a balance here in our office and we're willing to work through this with you. The teledentistry were some things that kind of came up. I know that we sourced quite a few different options out there. I don't know that any one is a bad way to go. You're just going to need to probably do your own research, see what fits best with your office and what existing third-party communications you already have in your practice that can work with you. Lots of webinars out there. I've sat through a Doxy. They have a great option. They work with a couple different third-party companies that can help put this onto your website. And I know that Mouthwatch had a really good, and we can add into some of these website links for you guys. There is 2 codes that they're stating to use. They've been a part of our CDT. It's the D9995. And that's the real-time encounter. So you guys are having that face-to-face, and then the 9996 is the information stored where you kind of report it a little bit different data service-wise. So look at those codes, but what you're going to find is probably with your insurance companies, if you're wanting to bill this, is they're not always a covered procedure. So it doesn't mean that you can't submit these codes, but what came out when I watched a couple of these webinars is some insurance companies are actually allowing you to, in the narrative, ask them if it's not a covered code, that you can actually ask them to downgrade it to a limited D0140 for payment, okay? So that's an option. There are some helpful financial relief sites that we can also give you guys. Somebody mentioned today that, what sites can we actually go to? There's a lot out there. The CDA has put out quite a few. If you just go to their website, they're pretty up to date. And they have the financial relief sites for the SBA, the CARES Act. They also have a really good SBA loan flow chart that's available. And so it kind of tells you the steps that you need to take and when. And then they also have a full SBA loan information for dentists, and it talks you through if you are going to do this, what that relief package will look like in the end. One more thing that you all need to do is, and this is also on that same website, the CDA, is you need to get the new labor posters. So that went into effect April 1. They extended it. But you guys need to go and get that labor poster and put it with all of your other labor posters. It's good, though, not to just get it, but to make sure that your team actually reads it, and then they sign off as part of your office manual that they understand what these new rules and laws are when it comes to this virus, so specifically around the coronavirus. And again, the CDA has that availability and how to order, and you can get it through them or another source, but that's something that you guys should be doing now. And there is, if you guys are wanting, we talked to about, donations and things like that. The CDA also has a specific site there that you can register yourselves as dentists to help in your community. So as this pandemic gets, before it gets better, things are probably going to get a little bit worse. And so they are asking for dentists to go on and register, because they may need support from us as a medical community to help in areas of taking vital signs. Some of the COVID testing sites are needing help triaging patients, treating emergencies, including providing local anesthesia to help with if somebody is coming into an emergency room situation that they can't handle. Some are wanting administering of oxygen, injectables, and that does include some vaccinations, writing prescriptions. And they're really asking for oral surgeons and dentists with anesthesiologist background and certificates to also come in and help with any like deep sedations in general that may need help with a shortage of the medical teams. They're stating that 20% today, I heard, of our medical community has this virus. So because they are currently right now in the thick of it, 20% is huge. So they're going to need the dentists to help. So I would love for you guys to visit that site. We can send out, I know we have the links, but the CDA has everything that you need for your community.
Wow, a lot of stuff there, Kara. Thank you so much.
Yeah.
We haven't heard from Betty, Barb, or Whitney, so I was thinking, should we put them on the spot with a little speed round? I don't
Sounds like a terrible idea.
A terrible idea. Well, there's a great question here, and Kara answered it online, I think, but I thought it was a really good question, and I can't find it, but it was something along the lines of, I'm having a team meet. We're doing a team meeting by Zoom next week. What are the top three? It doesn't have to be the top three, but I think the asker worded this way. What are three main topics that I should address with my team when we meet on a video chat next week? Who would like to raise their hand and tackle that?
Eddie?
Okay. Well, it really depends on the situation and the circumstances of that particular office. But one thing that I'm hearing right now is a lot of team members and employees that have not had great communication with the doctor at this point. And some of them are at home and they're wondering, do they have a job? So I think a great thing to happen with a team meeting first would be reassurance. Yesterday we talked about reassuring our patients that we're there for them, but I think they need that. Our team members, our employees need that as well, to know what does the future look like for them moving forward, and what is the plan for when you return in the practice. There's things that we know all of us can improve on. One of the coolest things about humans is we are extremely resilient. And one of the worst things about humans is that we are extremely resilient. So while right now we're like, oh, there's so many things we want to change and things that we were miserable with in our office, but then when we reopen, we might just go right back into that. So really working together as a team now. How do we want things to look different? How do we want to be better? So I would think that those are some priority topics, and as well find out what your employees want. What do the team members want as far as continuing education right now? What do they want to learn? That's all.
And I would agree with that. Allowing the team to contribute to that success of the reopening, I think, is really motivating, and we need that. And also, as I was talking about yesterday, getting people to talk about, or the doctors to talk about their treatment philosophies, so everybody's on the same page. What are you doing the same or differently? So you show a certain level of consistency throughout. That's it.
Great points from Betty and Barb. Anyone else want to join in?
I went ahead and put the links of everything that I just discussed over in the chat box. So if you guys want to go and copy those out, maybe paste them, save them, use them. And if there's any other links that you're wanting or have questions about, I'll watch the chat box and see if I can provide it for you.
Great. Somebody asked about our thoughts on starting to charge an additional fee to cover PPE. And we actually had an internal conversation about this. And I brought up the time way back when. Some of you who have been practicing for a while remember in the mid to late 80s when HIV sadly first hit the scene, and it was so mysterious and unknown, and everybody was afraid of, obviously nobody wants a disease that can be fatal, but everybody was in a total panic about it. And that's when I think the time in my career when dentists really, really stepped up our use of personal protective equipment. When Dave and I were in dental school, I hate to say it, but we weren't even necessarily made to use masks or gloves, which was totally, totally gross. So this was a huge change. And all of a sudden we felt like we were dressed for battle. And the big question was, this is costing me a fortune. How do I pass this along to my patients? And people made posters. I remember a practice that I knew had this poster, and they had like a mask and gloves and a gown taped to this poster, and it said like, this costs us, you know, $6 per patient, so there's going to be a small surcharge. Well, it didn't last long because patients felt like they were being nickeled and dimed. They were saying things like, you mean you weren't safe before this? You know, and it was, everything about it was negative. And I think we learned, some of us learned maybe the hard way, that it is not a good idea to charge for something which people expect to be the standard of care. And people expect an office where they won't catch an infection to be the standard of care. So we're not charging for that. Just don't do it. If you got to raise your fees a little bit, whatever. You know, we certainly don't want you to be overheaded to death, but it just looks really bad PR-wise to pass that directly along to the patients.
It will be interesting to see if the insurance companies are going to help us out any to help raise our reimbursements, because we are definitely going to incur more expense from this new PPE, for sure.
I wouldn't hold your breath on that one.
Now I know.
Exactly. Yeah.
I'm just throwing it out there. Are there any questions, any other questions that I can answer?
Looking in the chat box.
I'm probably going to get all the emails from everybody, and then
That's
I'll.
great. While we're looking in the chat box too, a bunch of people asked if this will be rebroadcast, and it was recorded and it will be rebroadcast on our Dental Practice Fixers YouTube channel. So if you just go to YouTube, I think Dave talked about this yesterday, that we usually use it only for our podcast, but we're making an exception now. So go to YouTube, search for Dental Practice Fixers, and today's webinar and yesterday's webinar will both be up there. Not sure when, knowing Sylvia, very soon, but not sure
But
when.
also, if you're more of a Facebook person, go onto our Facebook page, which is the Madow Center for Dental Practice Success. It's up there now, and as soon as this live portion is over, you can watch the recorded video of it like immediately, and also on our Dental Place group. So, by the way, if you're not a member of the Dental Place group, we hang out all the time with all these people and many, many more. We got about, I don't know, it's about 5,000 doctors and team members. So if we're not doing a webinar, you can go in the Dental Place anytime, reach any of us and 5,000 other docs and team members and ask a question, and you will get some really, really good answers. Just do a search for the Dental Place on Facebook, and you'll get to the group, and we'll let you in. But the video is available there right away, and also on our Facebook page.
Great. Anything else? Whitney, you haven't said anything, just because, you know, you did a lot of your talk yesterday. So want to give us some closing comments, maybe some real good positive vibe stuff moving forward?
I just want everyone to stay safe. And a lot of people have contacted me from yesterday. You can still contact me at whitney@madow.com. And yeah, I'd be happy to just be there for anyone, answer any questions anyone might have right now about marketing or whatever it may be, you know.
Sounds good.
That's it.
We're still continuing to get more questions. So even once this is over and the video will be available online, if you want, everybody, let's keep the conversation going in the Dental Place. As I said, we're all members there, and if you want to ask us questions in the Dental Place on Facebook, we'll be happy to keep the conversation going for as long as you want.
Absolutely.
Fantastic. Well, once again, Dr. Reef, we know that you're busy, even though many people aren't. You're always thinking, you're doing things 24/7. And so thanks so much for taking the time to prepare for this so well and to present this to so many great dentists and team members today. Your talk was absolutely fabulous, as we said, nonstop information. So
Thank you.
Thanks, everybody. Take care, everybody, please.
Okay, thanks. You too.
Bye-bye.
Bye-bye.
Take care, everybody.
Are we having a post-mortem or anything?